Hello, my name's Graham Martin. You don't know me, but I know you. I know a little bit about you. You're watching this because you're probably sitting at the prostate centre, very scared, very apprehensive. You've just been diagnosed with prostate cancer, or you're a friend or a member of the family of somebody who's also been diagnosed with prostate cancer, and you're contemplating, you're thinking about what to do next. And should you decide to have the surgery, whether you should go to the prostate centre and be looked after. Well, it was 2 years ago, almost the week, that I was diagnosed with prostate cancer. I was one of the youngest people at 46 to be diagnosed with that. And because it was a very aggressive cancer, and because it was a very young cancer, I had to be looked after very, very quickly. And I was so fortunate that my urologist recommended me to the one place that he said he would go to if he had prostate cancer, which was the Prostate Centre in Wimpole Street in London. And I have to say that from the very, very first time that I walked through the doors of the clinic in Wimpole Street, and ongoing, I've felt part of a family, bizarre though it is, an elite and a special group, being looked after by Dr. Kirby, Peter Amoroso, Kate Holmes, and the rest of the team at the Prostate Centre. So within 5 weeks, I'd been through some extra tests. I'd spent some time talking about nutrition, improving my fitness. They asked me to go to the gym every day for 90 minutes to work on the cross trainer to get ready, match fit, ready for the surgery, because then my recovery would be quicker. Also, I got to do some work on nutrition, so I improved my diet radically. And also, my partner and I spent some time with a clinical psychiatrist, I think is the phrase, and a sexual therapist to work out how I would be feeling, what would be going through my head, both before and after surgery. And that made an incredible difference. So I found myself in hospital in the early part of January, and I was out within 4 days, which by comparison to the NHS or other procedures is very, very brief, but it's average for the Prostate Centre. And I have to say that if you're in the clinic and being looked after by the team from the Prostate Centre, it's amazing. They're in early, they check you at 7 o'clock in the morning, and I had conversations at 11 o'clock at night and at the weekend. So you really do feel you're being looked after very, very well. And within about 5 days, I was back at the Prostate Centre to have the catheter removed. Not pleasant, I have to admit, but very, very quick. The frustration after that, of course, was that I was incontinent, but only for a couple of months. For some people, it's a shorter period. For some people, it's a longer period of time. But they're very, very good at making sure that you understand how quickly you can recover and what you can do to improve that level of continence. And it will go. It will come and go very, very quickly. The other thing that you'll do is spend time, I urge you to spend time with a sexual therapist, because there's no doubt that helped me and my partner significantly work out what it is that I could do, that we could do together, and also how to improve my chances of sexual function over a period of time. So I'd recommend that very, very highly to you. The other thing that was excellent, excuse me, was that they put me in touch with a buddy, somebody who'd been through the process before, somebody that I could ring up who wasn't part of the medical team, but nonetheless had been through the experience. And it was useful to be able to have that conversation, very, very supportive. And I'd recommend that if you can do that, you hook up with that. Watch out though, if you're of an age and you're fairly fit, they'll probably get you into some kind of running a marathon or doing a big cycle ride. I certainly have done one and about to do another event. So they're very, very keen in maintaining the relationship afterwards. You're part of a community. You're a part of an elite club. So I wish you good luck. I wish you good health. And I hope that you really do make the decision that's right for you. But as far as I'm concerned, going to the Prostate Centre, not only did they save my life, but also they gave me a sense of belonging to an organisation that really does care and who's got your well-being and your health as their number one interest. So whoever you are, I wish you good luck, and good health. Goodbye.